House Leader, third party.
Yes, thank you, Mr. Speaker. I've heard many stories of how the mental health crisis impacts family members. I've heard how psychiatric emergency services dismiss family members' desire to support their loved ones. I've heard how these services are reluctant to connect with family members to inform them of the status of their loved ones, only to have that mental health crisis come to a tragic end. Mr. Speaker, our current mental health system excludes family members who want to be involved in the support of their loved ones. Through you to the Minister of Mental Health and Addictions, will she make the necessary changes to allow more family involvement in the psychiatric care of their loved ones?
Minister of Health.
Thank you very much, Honourable Speaker. I think this is an important question. As you know, family members will be meeting outside the legislature today. It is my intention, if that works, to meet with them today to hear what they have to say. There are some specific cases involved that are the subject of patient quality review. I think it's clear that, and the people who know it's clear, are the doctors and nurse practitioners and nurses and healthcare workers that I've met with in the last few months who've spoken to these questions. They understand the crucial role of family, and what we continue to do is adapt clinical standards to ensure that they can fully involve families as much as absolutely possible in support for people who are dealing with mental health issues in acute care.
House Leader, third party, supplemental.
Mr. Speaker, we've heard how psychiatric emergency services are overwhelmed. Hundreds of people have taken to social media to tell their stories over recent years, stories that reflect how the treatment that they received let them down while they were at their most vulnerable time. My constituents Cindy Zimmer and Kenzie are here today, and they're advocating for changes in the mental health and addictions policy. They were excluded from the care of their brother, and earlier this year, he was discharged from psychiatric emergency services at the height of a mental health crisis. Pez was convinced he wouldn't commit suicide, but that's exactly what he did only minutes after discharge. Mr. Speaker, Cindy and Crystal are just two of many family members that I've talked to, and I know that members here have talked to, who want to be a part of the care team of their family members, but they're excluded. Will the minister make the necessary policy changes so other families don't have to experience the premature loss of a loved one?
Minister of Health.
Thank you. Well, I think it's the very least to say that our heart goes out to the families in these circumstances, and I'll look forward to meeting with them today personally on behalf of the Minister of Mental Health and Addictions to have that discussion. Certainly those who work with people dealing with mental health crises in the healthcare system are fully aware and fully supportive of the involvement of families in that process. In addition, we need other supports, the supports that are being provided and increased for suicide prevention, for early intervention, for reducing risk to save lives. All of these are elements of the comprehensive mental health system that we are building in British Columbia, and we need to build together.